What I was looking for is something that did not invade the home, something that allowed the family to be able to access the level of care that this youngster needed, and to provide opportunity for socialization, for education, and to be able to do the kinds of things to the maximum in play and socialization and learning that this child is capable of doing.
So the university, along with TPS and some people from the city, negotiated a deal where UT would do some improvements. We'd have a long-term lease and sort of reinvigorate the building.
But I think what makes the EduCare Center so unique is that it really is a collaboration of organizations. And I think the founders, Dr. Libby Rupert being one, what she recognized early on was that what organizations could do together far exceeded what any one organization could do individually or separately. And so the real beauty and strength of the model is, in my opinion, is that it's brought together a number of organizations, the public school system, the developmental disability system, the university system, daycare settings, private providers that offer good quality services.
When Michael came here, he was, it's all special needs kids. Everybody had problems of some type or another, and his problems were just like all the other kids that were here. And we work really hard at home to take care of him, and the care that he gets when he walks through the door at EduCare is the same as what we do at home. The level of caring, the level of knowledge, the level of experience is just wonderful for the way they take care of him. We always feel like he's in good, safe hands.
And the beauty of this facility is that we have a strong, enduring partnership with the Lucas County Board of Developmental Disabilities, with Toledo Public Schools, with Grady that operates the Prescribed Pediatric Center, and of course the University of Toledo, and in particular it was the Medical College of Ohio when this all started.
Well, we were delighted, Dr. Rupert and I, that our proposal to the Hasbro Foundation was received, and then we were invited to visit their board in Chicago. We presented, Dr. Rupert did a masterful job at presenting the need, the uniqueness of the program, and the integration of the program of kids developing in a normal way along with kids with special needs. We were a little nervous about our competition, and so it was even more gratifying when we received word that we were successful in getting a grant.
It's overwhelming for some of these parents to have so many doctor's appointments, so many therapist appointments to go to, so they can come to us and sometimes just say, okay, this is what's going on in my life, and we can just say, oh, not a problem, and they know that we're there to listen and help in any way, shape, form that we can. And
during the school year, he spends time at PPC, then goes to the Toledo Public classroom, and then back to PPC for after-school care. But it's all kind of mixed together. So everybody's on the same page and taking care of him in his care through the day.
This is a site also where we do provide professional education. So we do have medical students and pediatric residents, nurses from the University of Toledo, and we also have some physical therapists and language therapists.
But also that it would be an educational opportunity for nursing, for allied health, and for the College of Medicine.
Really, this is about the only place like this, even across the state. There's been others that have tried to start, and I don't know any of the details of how they've done or whatever, but if there are others in the state, the model is like Prescribed Pediatrics, and it's Libby Rupert's model that they're using. And you just can't say enough for her vision. I mean, she just really cares about people and cares about kids with special needs and families.
This is not one person's success. Everyone who works here, everyone who is at the administrative level of each of these organizations, the donors who have contributed so generously over the years, the grants that we've obtained for various efforts. It's a series of pieces that you put together.
This place has grabbed my heart for 8 years now, and I love the children. It's a lot of fun. The things that are so exciting to see is to work with them and see the small milestones that they can make, such as playing next to a child and being okay with that, whereas some other children, when they're typical, it's fun to see all the stages they go in, but sometimes it's easy to take that for granted. But when we work with these children, the little tiny steps they take are just amazing to see what they can accomplish.
The care has been top notch since the day he walked through the door. You know, and he's old now. He's probably one of the oldest kids here, which is over time they've made arrangements to be able to take care of him. Luckily, he stayed kind of small. So it's really just been a godsend.
Just all of the stories and memories that I could give you of all the different things that the kids have done is just amazing. It's a very special place.